Hi, I'm JeanAnne, one of the pharmacists here at Mulligan's, and I wanted to come on to talk about something super relevant right now, which is hay fever and COVID-19. As a sufferer of hay fever myself, I have been subject to those looks of alarm when I sneeze in public, even if I'm using sneeze etiquette, so I think it's important we know the differences between these two. Talking about the two conditions themselves, COVID-19 is a virus which attacks your immune system, whereas hay fever is actually your body attacking you. Your immune system comes into contact with an allergen in the air that is otherwise harmless and makes this big reaction that actually is doing more harm than good. The defining symptoms of COVID-19, we all know, are cough and fever. And the cough in COVID-19 tends to be more dry and persistent. And with hay fever, it's quite uncommon to have a cough, and if it does happen, it's more so at night. And despite the name, hay fever does not cause fever. Some of the defining symptoms of hay fever are sneezing, itchy, watery eyes, itchy nose, mouth, ears. These are all very common in hay fever and seen in most people, but they're not seen at all in COVID-19. But runny or blocked nose can be seen rarely in COVID-19, but it's very common in hay fever. In this case, you'd be looking for sort of green or yellow mucus from COVID-19, but a more clear one if it's hay fever. Some symptoms that happen in both conditions are loss of smell, headache, shortness of breath, or fatigue. And some symptoms which COVID-19 presents with, but hay fever does not, is sore throat and aches and pains. So that all said, we actually need to take into account the person as well. So let's say your child. Hay fever in children tends to present between the ages of 2 and 5, and then it peaks thereafter until young adulthood. But we know that in COVID-19, children don't really seem to get many symptoms. They tend to be more carriers. So that's something to consider there. And with regards to adults, it is less likely to develop hay fever at a later stage in your life, but it's not unheard of. So if you are experiencing some symptoms, don't just discount hay fever because it could be that. So as always, here at Mulligan's, we are here to answer any questions you may have. Be that over the phone and in store, we will be happy to help.